and welcome to the Same Day Surgery Center. We appreciate that you have chosen to have your joint replacement at our facility. Our goal is to ensure you have a positive experience and successful outcome. Once your procedure has been scheduled at our facility, our nurses will call you to review your medical and surgical history. You will also receive a call from our pharmacy team, who will speak with you about your allergies and medications. Please have a complete list of medications with dosing and instructions ready when they call. You may be scheduled for a pre-admission testing appointment at the Same Day Surgery Center to complete lab work, EKG, or x-rays that your surgeon or anesthesiologist has ordered. At this appointment, a nurse will review pre-op paperwork with you, provide you with education and instructions regarding your procedure, and answer any questions that you may have. You will be instructed to call the Same Day Surgery Center after 2 p.m. the day before surgery to learn what time you need to arrive for your procedure. On the day of your procedure, you will be escorted to your pre-op room upon arrival. One family member may remain with you at this time. You will be asked to change into a hospital gown and will be given a bag to place your belongings in. We recommend that you leave any jewelry or other valuables at home, but please make sure you do bring your ID. Your belongings bag will be placed in a locker or given to your family member for safekeeping during your procedure. For your safety, your pre-op nurse will verify the information in your medical record with you and complete any required documentation. You will have an IV, the surgical area will be prepped if required, and antibiotics may be started. Your surgeon will see you prior to surgery, review any questions you may have, and mark the surgical area for your safety. While in your pre-op room, you will meet your anesthesiologist and review your plan for anesthesia and pain management. If a nerve block is required, you will be moved to a holding room prior to surgery for placement of that block. The block numbs the affected extremity, which decreases the amount of pain you will experience after surgery. Your family member will be directed to the waiting room at this time. The nurse anesthetist and OR nurse who will be with you throughout the procedure will introduce themselves prior to surgery and again verify information with you for your safety. Once you leave the pre-op area and head to the operating room, your family member will be able to follow your progression throughout your stay utilizing a computerized tracking board in the Same Day Surgery Center waiting room. Because communication is important to us, your family will also receive verbal updates on the progress of your procedure. When your surgery is complete, your surgeon will speak with them either in person or by phone. From the operating room, you will be taken to the post-anesthesia care unit, also known as PACU, or recovery, where a nurse will closely monitor your vital signs, breathing, pain level, and incision site. Expect to spend approximately 1 hour in recovery. Please note that the time you spend in recovery is dependent on how well you do with anesthesia and is different for every individual. You will then be taken to a post-surgical floor of the hospital and your family will be directed where to meet you.